it changes. But
Do you have to ask as the treater, or
yes.
do I ask?
So typically once we submit, they will tell us they have so many visits. So average, I would say, is 12 to 20. Sometimes you're lucky and they have unlimited, which unfortunately is probably the worst part about my job is dealing with insurances. Luckily, I don't have to deal with them hand on hand because I'm an employee, but insurance companies tell you where, like, how often you can treat, and unfortunately, sometimes that's just how it goes. Sometimes I have to, hey, this is my last visit, keep doing this on your own if you really need me here, or I have to steer them maybe, okay, now it's time for PT, or see how it goes, you might have to get some other relief elsewhere too, so it depends. But that's probably the downside, and that's with anybody in healthcare, they'll tell you the same thing, that insurance is just dictating how much we can treat the patient based off of certain visits. Like even for instance, like a lot of chiropractors used to take x-rays right away, so we'll still get patients calling up asking if we do x-rays. My office does not, but for imaging orders in regards to the insurance realm, usually you have to have an x-ray before you get an MRI, and it's all that good fun stuff, so. Good question. Did you have a question? Oh, sorry.
All right. Cost. And I know it's gonna vary from your place to the next place. But what's a typical, I'd say I come in and you're gonna you can readjust my back.
So an average just adjustment cost is gonna be anywhere from, I would say, 40 to probably, in a big city, you'll see as much as like $100 for just an adjustment. Sometimes you get as low as like 25, but just for your average adjustment, I would say you're gonna run from 40 to 100 depending on the city that you're in.
And time. I come in, how long is it gonna take you to do that?
Depends on the treatment we're treating. So I have patients that I'll see for 10 minutes. I have patients that I see for a half hour. New patients are anywhere from 45 minutes to an hour long book. I would say average is probably going to be about 15 minutes. But depending on the practice you have, if you are what we call a straight chiropractor and you basically just work the spine, they can get you out within like 3 to 5 minutes.
Come in.
Yep, and see you later. Which, it works for people and that's what they like, so that's what they keep doing, and that's okay.
Now, I think you touched base on it a little bit, but what's the determining factor that, all right, you're done, I don't have to line you anymore, you're good?
So one of the things we go to school for is to assess, and we assess with our hands, with palpation, and with motion. So a lot of it is subjective, how the patient's feeling, and it's what we feel. So feeling that joint, see if it's moving well, seeing their range of motion. Range of motion is a huge thing. A lot of times like swelling, if they're swelling in there and that kind of thing, but the joint. So I always tell patients like before I adjust them, or how I know something needs to be adjusted, is when I'm working through the spine and something all of a sudden feels like a block of wood. Whereas it should kind of feel like, coming from it should feel like a block of cheese. Be solid, firm, to have good bounce to it. But something has a block of wood end feeling, okay, that needs some motion. This is causing some dysfunction, causing some pain. This is what we gotta work. So assessing that and seeing how that's feeling, that's the biggest thing when it comes to an adjustment.
All right, you guys, I know I'm afraid to ask, how much does a chiropractor make?
So, good question, varies between cities. I would say starting out, because we don't have a residency program, you're looking at starting anywhere from like 45 to 75 is typically your starting point. And then as you build up your clientele, you can make as nearly as like a couple $100,000.
So how do you get paid based on the number of clients you have, or do
It
you have
depends on your
salary?
clinic. So myself, I am paid, I have a base wage, and then I get paid off of the income, a percentage of the income that I bring into the clinic. So some, especially your patients that are just your straight chiropractor, they get a percentage of how many people they see. So the more people they can see, the better. So they're gonna try to get people in and out, and that's how they make money. Some people it's percentage. Sometimes, depending on the clinic you are, you can be, so I'm an associate chiropractor. You can be also an independent contractor, which you have an overhead that you pay to someone, so you pay them, say, 40-30%, and then you get the rest of your earnings. So that happens as well, but you're technically self-employed, so a lot of times you get no benefits, no insurance, nothing like that. Which sometimes it works out for the better, because that overhead is typically less money than what you would be paying if you were an associate. But you'd also be on your own. But a lot of times it's, you start and you have to build up your clientele, build up, so you'll see a lot of like new starting chiropractors like go out new screens or things like that to try to build up their clientele and get used to the community.
So she's got her table in the hallway, we're gonna set it up, you guys are all getting screen joy.
So it varies. I will say that the cost of schooling is very expensive. So unfortunately, chiropractors and veterinarians are the two that have the most amount of schooling compared to the money that you earn. Now, it's not everybody. I mean, if you're good at what you do, you do well. But unfortunately, our schooling is pretty expensive, unfortunately.
So, lacrosse, they don't have chiropractic.
No.
You just went there to get your.
I got my undergrad there.
undergrad.
So there's
How many-
only maybe 12 to 15 schools in the country. So the closest one would probably be in the cities, Northwestern. There's one in Chicago, one in Iowa. I went to St. Louis, so those would probably be the closest ones. The biggest thing when it comes to chiropractic schools is their philosophy and how they train. So what we call a left side versus right side chiropractic. The left side is going to be more your straight spine, that kind, whereas right side is going to be your mix of soft tissue kind of thing. So schools vary in that sense too. Some only specialize in treating spine, some have a more wide variety, which is a good thing because I think the good and the bad of our profession is that we all are a little bit different. So how I treat a patient is completely different than how my colleague treats a patient. Well, not completely, but we are very similar, but we do differ in some ways. How I treat is probably different than the person down the street and who comes to me. Sometimes I'm not the best suited for them, which is okay. So that's kind of like the good and the bad of our profession.
So how many people are in your office?
Just two, so it's me and another doc. And then his wife also works there too, but she does more like behind the scene work, so we're a very small practice.
And that's typical, I think, for most chiropractic.
Oh, yeah.
Right?
Especially
Especially
in
here.
small towns.
Wausau, yeah.
Small towns are pretty small. If you get into bigger cities, you will have your chiropractors that are working in like your mainstream clinics. That's definitely a bigger thing coming. So maybe someday we'll also will happen. For now, I'm good with my small town practice. Yeah.
So, infant-wise, what are some of the things, I know it said working with colicky and stuff like that, what are some other benefits for infants?
It goes back to motion, so working on stimulating that nervous system, because you think of a infant and being in the womb, they're stuck in this rounded, flexed fetal position for an extended period of time. So when they come out, it's new surroundings, a lot of stimulus, so working to work those soft tissues in those joints, which are mostly just cartilage at that point, and kind of stretching things out to get them used to their new environment has an impact on the nervous system. So that's really cool. And that's how you can kind of help with constipation and colic and some sleep issues and things like that. So how I treat an infant is very different than how I would treat you. It's very, very different.
I know a chiropractor, and she's treated her children like for colds and everything.
Yeah, just with so your neck, your central nervous system, there's a ton of ways you can affect the immune system just by stimulating the nervous system in your neck. And there's even some theories because you have your brain and then your brain stem that connects to your rest of your spine or your spinal cord, and that itself can even affect the digestive tract. You have your main nerve, your vagus nerve, it stimulates your heart, your esophagus. So GI issues, sometimes like even acid reflux, That's a big one that a lot of people will get adjustments for because they find that stimulation helps with the nervous system to relax that so it's not as inflamed. Immune system, that upper cervical area. Last week I had a patient with vertigo, which just a little bit of work helps kind of with that and the dizziness that they were experiencing, which is kind of cool. Anybody else? Anybody have anything going on that they have questions about? Ooh, yeah? When did it start? Trigger finger? Can't straighten it?
It's like it's a lot. It's been getting worse.
So, trigger finger, the key is to actually stretch where the muscle originates, which for there, if you're talking your ring finger, it originates up at your elbow. So even doing just some massage to that forearm and releasing it that way. Mm-hmm.
Haley's been showing me a lot of different.
Yeah.
She's working on her PT.
Uh-huh. Yeah,
What if you have more upper back problems than lower back?
yeah, you bet. Same thing. So it's just not as common as lower back, but I would say with students, upper back, headaches, huge. So a lot of times releasing the soft tissue. I'm not a huge Nazi about posture because it's hard to have perfect posture. I'll actually tell patients, which this is really good for all of you guys. So when we talk about good posture, I want someone to come, real quick. Show me like what they think is good posture for sitting.
Looking at me, I'm about to get roasted.
Looks like you got volunteered, so come on down.
Come on, Cole.
Somebody's about to get roasted.
Yeah, I don't got good posture, though.
All right, just sit in the chair with what you think is really, really good posture. Okay, so not bad. Now actually stand up for a second. I'm gonna sit here. All right, sit down again. So right now we're looking at how the spine goes. So the biggest thing about posture is you want your spine itself to be in a really good alignment. So what I tell patients is he's actually doing a pretty decent job. But when a lot of people think they have really good posture, especially for females, we stick our shoulders back really, really tight up here, which makes all of this worse, especially upper back pain. So what I will tell patients, round forward for me. All I want you to do is take that belly button and push that belly button toward your cheek. Yep. So if you start with posture right at that low back area, that will help alleviate everything else. So you might round forward a little bit here, but your feet are nice and flat, your arms are nice and loose, but you're still in a good, what we call neutral alignment. So this is nice and soft, which will help that mid-back pain or headaches or even low back pain. But I always say posture actually comes from that low back when you're sitting and moves up. So when you see like the lumbar supports, this is the reason why.
They
So
say
it
so
works
much
the way
of
up.
that is coming from our core. If we don't have a strong core, which most of us don't.
Yes,
Especially me.
But
yes,
that's where we get that.
you bet.
So
Yes,
speaking of, you mentioned backpacks.
yeah.
Have you been seeing, now you've only been in it for 3 years, but Steve's been there for a while. Are you seeing a bigger trend with,
Oh my gosh.
or is it gonna just keep getting worse, obviously?
Headaches and the heaviness of backpacks. So what we call, it's called upper cross syndrome or anterior head carriage, is basically this. When we see patients, their head is moving forward, which is putting more strain on their upper back, which is because we're sitting, we have a heavy backpack, we're walking around like this in the hallway, we're slinging it over one shoulder. It's huge. And then with the electronic devices, headaches because of the visual stimulus that we're getting, huge. I would say, and it's in younger patients. So we're seeing our head move forward at a younger age, where I'm seeing that now in like high schoolers compared to like back in the day, you wouldn't see any sort of migration of your head until your 30s or 40s. But now you're seeing patients that are coming in like this when they're 17 years old. So yes, backpacks are a huge one. So try to lighten your backpack. Make the walk all the way to the third floor to empty your locker, or empty your backpack at your locker. I was not that person, and I was on the third floor. And always wear your backpack, both straps on your shoulders. And keep it from here to here, so nothing trailing super low or nothing super high.
There you go. You're gonna be healthier now.
We can hope, right?
We can only hope.
Well, thanks for having me, guys.
Thank you.